You've declared a state of emergency. Can you give us a sense of what that means?
Well, it's a public health emergency, Kieran, so it comes in under the Territory's Public Health Act. It's a consistent approach across all of the states and territories to enact appropriate legislation that enables us to enforce the requirements that the Prime Minister announced yesterday after the National Cabinet, particularly in relation to people self-isolating after returning from overseas. There are a range of additional powers that it provides our Chief Health Officer. Now, we've been clear that we don't think there will be a huge need to use these powers, but they are there just in case. Everyone so far in the ACT who's been asked to self-isolate has done that without any complaint, and in fact people have been very willing to enter into that process because they don't want to risk the health of others.
And at this stage there are 2 people, is that right, in the ACT with coronavirus?
Yes, so we have 2 confirmed cases, both understood to have contracted the virus interstate, so outside of the ACT. Our first case that was identified last week is recovering well, and our second case is being assessed now, but the indications are that will also be a recovery. So it's both individuals were in their 30s, but the prognosis for both is good.
The school situation, I'm interested in your view on that, because I had Mr Albanese on earlier in the program. He thinks it's inevitable that we get to a situation where schools will be closed. Some are taking it upon themselves to do that already. What's your view?
Well, certainly the national policy approach allows for localised closure of schools should there be a positive case, and then contact tracing and isolation. So that is the appropriate response at this point in time. Clearly, closing schools has a much broader implication across society and the economy. And I suspect once closed, schools would not be able to reopen anytime soon. So there is a lot of confusion. A lot of people think, oh, just close them for a week or 2 and then this problem's over. That is not the case. And so a decision to close schools may be necessary, but it could be a decision then that schools are closed for the rest of the year. I think people need to understand that this is not something that is resolved by a couple of weeks of quarantine. Until there is a vaccine for COVID-19, or until nearly everyone becomes infected, we are dealing with this situation for weeks, months and possibly years. So all of these efforts now are about, as has been described, flattening the curve to delay the infection rates, but it doesn't mean the problem goes away. It just means it will be drawn out over a longer period. So my message to the Canberra community this morning was that to expect months and months of this and to be straight with people about just how challenging and grim this situation is. All of these measures are important and they will flatten the curve, but they don't resolve the issue. And this virus will continue to circulate the globe until there is a vaccine, or until a lot of people become infected and there's a natural immunity that's developed.
Yeah, and in terms of that you're arguing then every step needs to be one which is not just a knee-jerk reaction. You want to know that you're making the right call at the right time, because if and when the school's shut, that's going to be the case possibly till the end of the year.
That's right. And look, there are times here where the choice is between really bad outcome and terrible outcome. Sometimes there are no good public policy choices here, and we have to effectively choose the least worst and balance a whole range of competing priorities. And, the obvious follow-up question on if the schools do close, then who's looking after the kids? and it shouldn't be grandparents in light of the information we have in relation to the spread of the virus and the risk that that imposes, particularly for elderly people. Not to mention the workforce challenges in terms of people being out of the workforce in our health professionals, those who are providing essential services across the community. If they're having to be home looking after kids, that very much changes the way that we can respond as a country. And then, of course, there are a range of economic implications as well. Now, first and foremost, the National Cabinet is focused on consensus on getting a uniform national approach. And I think that is really important, and it's been a benefit of having such a process, states and territories and the Commonwealth working together. It's an unprecedented challenge. I've been in politics for, this is my 15th year. I've never seen or experienced anything like this, but we are all going to work our way through it. We'll come out of it together, provided we heed the best health advice and we make well-informed and sensible decisions that balance the competing priorities. And there's some tough decisions that lie ahead. I know that bears very heavily on me as a leader even of a small jurisdiction, let alone what the larger states with more diverse communities and rural and remote issues to deal with. But we're working together nationally and I believe effectively. And I do want to send that message of reassurance that across the partisan divide, big jurisdictions, small jurisdictions, we are working well together. We'll continue to meet regularly and make evidence-based and informed decisions throughout this process. But already things change rapidly and the situation may require more significant responses. But we'll make those decisions if and when we need to in the best interests of Australians.